I'm Linda Manning, and I work at the Osher Center for Integrative Medicine at Vanderbilt University, just down the block, so I didn't have to come far today to talk to you. And while mindfulness is not a direct treatment for pulmonary fibrosis, I'm sure that you are aware that for many people, there's a lot of stress that comes with this disease, and mindfulness can help us deal with the stress for any chronic disease process. So what is mindfulness? John Kabat-Zinn pioneered the use of mindfulness in medical settings at the University of Massachusetts Center for Health Medicine and Society about 30 plus years ago. And this is his definition. He says that mindfulness is the awareness that comes from paying attention in a particular way, on purpose, so you have an intention to pay attention. In the present moment, you may notice that we spend a lot of our time in the past and in the future, thinking about what happened yesterday and how we wish it were different, or anticipating what's going to happen tomorrow. Anybody in here have that problem? Okay. So in the present moment, which is really the only moment we have, and non-judgmentally. And non-judgmentally doesn't mean we don't have judgmental thoughts. All of us have judgmental thoughts. What Kabat-Zinn is talking about here is learning to accept whatever is arising, whatever thoughts, emotions, physical sensations we are having, that we sort of welcome and accept them and have a relationship with them rather than trying to push them away. Not always an easy thing. So basically, we use this little cartoon a lot around our shop. You'll see a person and a dog walking down the path. There's a beautiful sunset and some trees ahead. The dog sees the sunset and the trees. The person has a few million other things clouding up their mind. So basically, we're here to teach you to be more like your dogs. So rather than just talk about mindfulness, I thought we might practice a little bit. So I invite you to put both feet flat on the floor, sit in a way that your body is relaxed and alert. You might want to close your eyes, or if you're more comfortable, just find a spot in front of you on the table or on the floor and focus your eyes there for a moment. First thing that I want to suggest that you do is simply notice where your body makes contact with the chair and the floor. Feeling your feet inside your shoes, feeling your body against the seat of the chair and the back of the chair. Reminding ourselves that this support is there for us all the time. The support of the chair, of the floor, of the building, and of the earth beneath the building. And then for just a few moments, I invite you to focus your attention as much as is possible on the sounds that you hear in the room. It might be the sound of my voice, but it could also be the sound of a door opening or closing, papers rattling, the sound of your own breathing. Whatever layers of sound you might notice, to try and focus your attention there as much as possible. And if you're like me, while you're focusing your attention, suddenly your mind will wander off somewhere else. What's going to happen later today in this summit, what your evening plans are, what you had for lunch. That's no problem. It's just what minds do. But when you notice it, invite your mind back to a focus on the sounds in the room. In a 5-minute period, you may have to do that 50 times, and that's fine. The goal is not to not be distracted. We will always be distracted. The goal is to notice when we get distracted and bring our attention back. And after a while, this point of focus, the sounds around us, can sort of become a home base, a place that feels safe and comfortable and familiar, and helps us to settle our minds. And now I invite you to bring your attention back to your body again, feeling the places where your body meets the chair, where your feet meet the floor, noticing that support underneath you. And as you're comfortable, you can open your eyes or bring your attention back to the room. I'm curious, how was that for you? What did you notice in that process? Calming, relaxed. It's interesting, when we focus our attention, we tend to relax. We don't want to make relaxation the goal, because then we'll just be saying to ourselves, relax, 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 and that doesn't work. But if your goal is focusing your attention, often a side effect is relaxation, and it can calm anxiety, it can center us and ground us, and help us to deal better with the stress of our day or the stress of whatever we're dealing with in our illness. So I offer you that as one possibility. And just want to let you know that this kind of mindfulness practice is frequently used in medical settings. The Journal of American Medical Association has talked about mindfulness as a treatment. And the one that is most commonly used in medical settings is a program called Mindfulness-Based Stress Reduction, which is the one that was created by John Kabat-Zinn. But there are many other possibilities. The Mindfulness-Based Stress Reduction is an 8-week-long program, 2.5 hours a week for 8 weeks, and a day-long silent retreat. So it's a pretty intensive deep dive into mindfulness. But mindfulness can happen in 5 minutes, like we just did. So it's a matter of learning how to work with your mind and your relationship with your mind. Some of the outcomes that have been found in research related to mindfulness practice are increased immune function, shorter and less severe colds, reduced fatigue for people undergoing chemotherapy who are cancer patients. We use it a lot in our clinic to help people who are dealing with chronic pain, so decreased pain intensity and unpleasantness. It helps with cognitive function and reduction of all kinds of symptoms and risks. But it also just helps with mental health and well-being. So again, mindfulness-based cognitive therapy, another form of mindfulness practice, is related to decreased depression or fewer relapses in depression, and as we talked about, decreased anxiety. So it can be very helpful for many reasons. Mindfulness actually works with the brain and the function of the brain. This is a picture of Richie Davidson from the University of Wisconsin. He's done a lot of research with the Dalai Lama, there in the middle, and the Dalai Lama's monks, who are long-term meditators, people who have meditated more than 10,000 hours. And what he has found in examining these meditators is that there are actual changes in brain structure and function with meditation. Now, the good news for the rest of us is that we now know that these changes in brain structure and function can happen in as little as 8 weeks of practice. You don't have to do 10,000 hours to get there. So what kind of changes are we talking about? We have noticed increased gray matter in the hippocampus, which is a part of the brain that is responsible for learning and memory. It also helps us to distinguish between true threat and things that seem like a threat. And decreased gray matter in the amygdala. The amygdala, you may know, is the threat center. It's the part of the brain that sends out an alarm when we feel we are in danger. And it can get overreactive so that you feel like you're in danger all the time, and mindfulness helps decrease its sensitivity or irritability. There's also increases in brain thickness in areas like the prefrontal cortex, which is executive decision making, and the insula, which is a part of the brain that helps us to be in touch with sensations within our bodies. So it helps us to get to know our bodies better. So those are the structural changes that can happen, but there are also changes in brain function. So for example, most of the time when we're not paying attention, when we're just going through our day, moment to moment, the part of the brain that's operating full-time is something called the default mode network. And the default mode network is many different structures, but they're all sort of arranged around things like rumination and mind wandering. And when we are ruminating, thinking over and over about that thing that happened yesterday we didn't like, or anticipating that thing that's going to happen tomorrow, we feel worse. We are more likely to be depressed or anxious. So that activity decreases with mindfulness practice, and the observational mode network increases with mindfulness practice. The observational mode network is the part of the brain that is the kind observer, that is simply noticing our experience as we're having it. So it's a way of stepping back just a little and getting a little bit of space between what you're experiencing and your awareness of what you're experiencing. And this, again, tends to calm us down and allow us to make better decisions. So there are lots of benefits from mindfulness. Here's some of them that have been studied over the last 30 plus years. It helps us to regulate our attention. It helps us with that non-judgmental awareness where we are accepting what's happening and observing it. It helps us to calm, physiological hypoarousal. It can actually affect the vagus nerve, which supports the parasympathetic nervous system, which is the opposite of fight or flight. So it helps us to calm down, helps us with present moment focus, and we tend to have better responsiveness and less reactivity. So being mindful doesn't mean that you don't have fears or concerns. It means that when you have them, you respond to them in a way that is more congruent with your own value system rather than being reactive. And it also helps to increase empathy and compassion, both for self and for other people. So it works well for caregivers as well. So I thought, let's see, we have time to do one more little loving kindness practice, which is an empathy and compassion practice in mindfulness. Y'all willing to try it? Okay, so the same thing, put both feet flat on the floor. Sit in a way that your body is comfortable, alert, and relaxed. You can either close your eyes or find a spot to focus on. And this time, I'm going to say some phrases out loud, and I invite you to repeat the phrases silently to yourself. And the first time, we're going to do it for ourselves. So you're going to repeat these phrases to you, okay? May I be safe and protected. May I be well. May I be free from unnecessary suffering. May I find peace. And then we're going to do it another time, and this time I want you to bring to mind someone you love and care about, someone that you want to wish well. You might even visualize their face. I'm going to say the phrases again, and this time repeat them silently for that person. May you be safe and protected. May you be well. May you be free from all unnecessary suffering. May you find peace. And as you're ready, you can open your eyes, bring your attention back. When you do a loving kindness meditation, you always start with yourself. Sometimes the person we have the most difficulty being kind to is ourselves. Is that true for anybody other than me? Okay. So always start with yourself and then move to someone you love. Those are usually easy. If you're feeling particularly brave, you can do a loving kindness meditation for someone you're irritated with. Or someone that you want to help, but you are helpless to help them, right? You don't have anything particular you can do. You can wish them loving kindness. If you get really brave, you can do loving kindness for all people everywhere. So you can work up to that one. Let me just show you, we're going to skip that because we're running out of time, a couple of resources that you might be able to use. I understand you all are going to get access to these slides later, so I put some resources on here. There's a website through the University of California at Los Angeles. The Mindful Awareness Research Center has free guided meditations of many different kinds that you can use. Be aware that many times people use breath to focus on for mindfulness, and that may or may not be comfortable for you. So if you would prefer not to use breath, look for something that focuses on sound or a body scan, which just focuses on different parts of the body. You can download them onto your phone and listen to them anytime. They have 3-minute ones, 5-minute ones, 10-minute ones, 15-minute ones, 30-minute ones. Or you can get apps for your smartphone. There's an app for everything now, right? A couple of my favorites are one called Insight Timer. What's fun about this one is it tells you how many people are meditating with you at the same time around the world. Or there's one called Headspace and one called Mind Shift, and all of the links are right there. You can download them on your phone. Some of them are free. Some of them have a very small charge, like $3 or $4, so something like that. If you are curious about books, I have listed some books that talk about mindfulness and the neuroscience of mindfulness and how to use mindfulness in your life for stress reduction. And again, you're going to get access to these, is my understanding. And then there's some articles in case you want to look into the scholarly part. I'll put it back on here. People are taking pictures. Any questions that anyone has about mindfulness practice or how you might be able to use it? Yes. That's a really good question. If you want to make the official distinction, mindfulness is that awareness that comes through training the mind through meditation. So meditation is the practice, mindfulness is the state we get to. But a lot of people use it interchangeably. Yes?
Do you ever complement this with like color, sound, or aromatherapy?
Yes, actually, we do all of the above. We use sound. There's so many things that can affect the vagus nerve, which is that part that helps us to calm. So sound, humming, also things like aromatherapy, as you mentioned, or gentle movement. You can combine mindfulness with very gentle movement as well. Yeah. Walking meditation, for example. Other questions? All right. Thank you all very much for having me. I hope you enjoy the rest of your conference.